Well, welcome to this product demonstration video for the DSD-8135 13-in-1 saliva or oral fluid drug testing kits provided by UKDrugTesting. The panel test itself comes in this particular foil, the swab for collecting the saliva sample in a cellophane wrapper, and the little device for squeezing the saliva out and adding it in a pipette format into the test wells on the cassette is provided separately. So there's three different components. It comes either in 1s, 2s, 5s or 10s with a set of instructions like this, within simple instructions of how to follow, or in manufacturer's cartons of 15 tests, which will be packed in the manufacturer's carton with the full data sheet. Now, the data sheet is available to download online, but we're going to demonstrate this test for you now to show you the simple procedure in how to perform the drug test. So, when you're ready to do the test, remove the cassette from its foil wrapper. Inside the foil wrapper is a little pouch of desiccant, which will keep the test in perfect condition until it's opened. Once you have opened it, you need to use it and keep it dry within 24 hours. So don't open it before you are ready to run the test. You'll see along the bottom here, you've got 1, 2, 3, 4, 5 sample wells. Now, the columns on the left-hand side, you'll see, have a C area for the control line, but also multiple T's. These are the test line zones, and the test line zones are in relation to the coding in the top of the element on the cassette. So T1 on this column is opiates, T2 is the cocaine, T3 is the amphetamine, T4 PCP, etc. So you read multiple test lines in the presence of a control line for those result interpretations when it's ready. The cannabis test is a single test run membrane just with one test line, and the alcohol is a color change pad. Now I'll show you how you interpret the alcohol result using a simple colour chart such as this one. This is an example card. You will be provided when you buy these tests with a similar card. It may be a multi-function or multi-parameter card, in which case you are only interested in the saliva alcohol or alcohol element of the card. But you are basically at 2 minutes comparing the change in that pad on the alcohol test against a colour chart to read the corresponding alcohol level. Now, when you're ready to do the test, you will remove the saliva swab from its container, and when you're getting the swab ready, also remove this little device from its container. This is the device that you will use to collect the saliva, and you're aiming to get a minimum saliva level at this arrow indicator here, but if it's more in there, up to around 2 mils of saliva, all well and good. This lid comes off. The swab, when it's saturated with saliva, is pushed down and squeezed into here to discharge its saliva into this little bell. And then when you've completed sampling your saliva, the little pipette just flips up like that, and you've effectively got a pipette here with which you can dispatch 3 drops of saliva into each of the sample wells. Now, collecting saliva for a saliva drug test is a bit complicated, and you need to do it correctly. The correct procedure is that the person being tested should not have eaten or drunk anything for a minimum of 10 minutes, ideally 20 minutes. They should have refrained from smoking for a similar period. Before you ask them to put the swab into their mouth, ask them to move the tongue around the top and bottom teeth, in front of the teeth and behind the teeth, and then to lick or lap the base of the mouth up towards the base of the front teeth, and to repeat this process for 10 to 15 times. The action stimulates the production of saliva and will get you a good pool of saliva in which to ask the person to place the swab and saturate it for about 1 to 1.5 minutes. Ask them to feed saliva onto this swab, and they will feed this very successfully and feel the swab. If I open this one and demonstrate, when they come out of the packet, it is incredibly firm and hard. There's no movement in that at all. It's like very rigid. But when it's saturated with saliva, they will feel that softening up. And when that has occurred, you then ask them to move it around the mouth, and you use this swab on the stick to rub in front of the teeth, behind the teeth, the gums, the cheeks, and over the tongue. And you need to do that to pick up any deposits of drugs that are still lingering around the mouth, and that's particularly important when you're detecting or testing for cannabis and methadone. So I'm going to perform that now on myself, collect this saliva sample, and then demonstrate this test being run in just 2 to 3 minutes time. Now I have collected a sample on my own mouth with this saliva swab. You'll see that it's now incredibly soft and flexible, and that will allow you to remove the lid of the collector and, holding it upright, dispatch the contents of this into the well. You need to push quite firmly, but it should hold an adequate volume of saliva if pushed firmly to reach that line. You see that's now just at the line, which is sufficient. So I'm going to now reconnect the two, invert the test, and I've now got a pipette device that I can squeeze very gently. 1, 2, 1, 2, 1, 2 drops into each well we'll start with. And then if you've got more saliva to discharge, you can go back and put additional sample in. Just by flipping that little dispatch backwards, you lock this device, and you can see there's still adequate saliva in there, which, if I don't get full test results on this panel, I can add further to the saliva too. But you'll see what's happening now. Almost immediately the lateral flow is running up through these test lines. We've got to have control lines showing, and the correct read time for this is between 8 and 10 minutes. So what I'm going to do now is just place this on a flat surface like that, stop this video, and we'll come back and demonstrate to you the results showing at the correct read time for this test device. Well, we're now at between 8 and 10 minutes, and I'm going to show you how to interpret these results. You'll see that I've got a full set of T lines showing. Now, just look at the thinness and very faintness of that THC test line. That is still a clear negative result. It does not matter how thin or how faint the T line is. As long as you've got a control line showing at the top of the column, you must interpret these results as clear negatives. And the important reminder here is that these tests are all testing at different cutoff levels, and the cannabis one is extremely low. It always tends to be the thinnest and faintest T line, so do not try to interpret or infer anything from a very faint cannabis test line result. Let's look at the alcohol as well. You see this pad hasn't changed colour at all, giving a negative result for saliva alcohol concentration. If I had a blue coloration, then I'd look for the nearest match, and that would be a semi-quantitative indicator of the approximate level of alcohol at the time of testing. You would then need to move on to a digital breathalyzer to confirm the absolute alcohol level at the time of testing. As far as these other drugs are concerned, as long as you've got a control line showing at the top of the column and a test line showing, it doesn't matter how quickly it develops, and you can interpret these results, all negative results, as early as 3 to 5 minutes. But where you haven't got a test line showing and the control line is showing, you must wait the full 10 minutes development time before interpreting a non-negative or presumptive positive result. And all those should be confirmed using a laboratory accredited method. So an incredibly quick and easy test to perform gives you 13 individual positive or negative results for the 12 drugs and the alcohol result in a very easy to perform test. The results are very accurate, in the order of between 98 and 99.6% positive compared to laboratory tests. But as I stress always on these video demonstrations, positive results must be sent for confirmation testing to absolutely determine what has caused that non-negative result to occur and what drug and the level of that drug in the sample that has caused that result. So I hope you have found this product demonstration of use. The DSD-8135 is an incredibly good value, easy to use test that we've been selling through the UKDrugTesting site now for many years, and it's proven extremely reliable and accurate in clinical and practical usage. Thanks for watching.